All right, let's talk about something that's quietly becoming a massive crisis. It's happening in the one place we're supposed to feel the safest, our healthcare system. We're diving into the hidden epidemic of data breaches. Think about it. Your health records, your prescriptions, even your doctor's appointments, they're all right there, just a click away on your phone or computer. It's incredibly convenient, right? But what's the hidden cost? What are we really giving up for all this convenience? I mean, let's face it. Your healthcare is now a digital product. It's just a fact of modern life. Everything from seeing your doctor on a video call to checking your test results on an app, it's all online now. And honestly, a lot of this is amazing. You can see a doctor without leaving your couch. Super smart AI is helping read your scans, catching things a human eye might miss. You've got 24/7 access to your own records through portals. It's all about connected care. But, and this is a big but, this whole connected world has a dark side. It's created a massive, glaring vulnerability. So while we've all been busy enjoying these new digital tools, something else has been happening in the background. Our entire healthcare system and all of our private data inside it has come under attack. It's a full-on siege. And when you see the numbers, well, staggering doesn't even begin to cover it. Okay, get ready for this. 45 billion with a B. That's how many individual records were exposed in major breaches just this year. I mean, that number is it's almost meaningless. It's so big. It's hard to even wrap your head around that scale. And what about the money? Well, the average cost for just one of these data breaches in the US is now over $10 million. Think about that. That's not just some line item on a spreadsheet for the IT department. That's a huge financial hit that affects the entire healthcare system. But let's bring it down from the billions and millions to something more personal. 97. That's how many people became victims of cybercrime every single hour this year. Every hour. It's a relentless, nonstop attack happening to real people right now. So you're probably thinking, okay, where is all this coming from? Is it still the classic movie hacker in a hoodie trying to break down the main hospital firewall? Nope. The game has totally changed. It used to be about kicking down the front door of the hospital's network. That was the old way. The new threat? It's much smarter. It's about finding an unlocked side window left open by a trusted contractor, a third-party vendor that the hospital works with every single day. And this gets us right to the heart of the problem. We're calling it the invisible threat. Because, get this, the biggest risk to your private health data probably isn't your doctor's office at all. It's all the companies they work with. Yeah, in the cybersecurity world, they have a name for this. Third-party risk. It's basically the danger that comes from all the outside partners a hospital uses. You know, the company that makes their electronic health record software, or the one that handles their billing, or even the new AI firm that analyzes scans. They all have keys to the kingdom, so to speak. And look, this isn't just a theory. A recent survey asked hospitals' security chiefs, what's the biggest new risk you're worried about? An overwhelming 74%, nearly 3 out of 4, said it was their vendors. You know, the companies providing EHR systems, AI tools, and cloud services. The danger isn't inside the building anymore. It's outside. And you can see this pattern everywhere when you look at the biggest breaches this year. At companies like Qantas and TransUnion, the root cause was a weak link in their supply chain. And yep, it's the same story in healthcare. The huge breach at Yale New Haven Health, it follows the exact same playbook. Attackers didn't go for the front door. They found a weaker partner to exploit. I mean, listen to this quote from a ransomware specialist. He puts it so bluntly. Your vendors will be compromised, and your credentials will be stolen. It's not a possibility he's talking about. He's stating it as a fact. The assumption now is that it's going to happen. So, okay, what does this actually mean for you, for me, for patients? What happens when a piece of code breaks in this vast digital supply chain? Well, it's not just about your data being stolen anymore. This is where it gets really serious. It's like a domino effect that goes from a data breach all the way to your diagnosis. Just look at this. We're talking nearly 2/3 of hospitals, 63%, saying they've had a security incident because of a vendor. And for more than half of those hospitals, that breach didn't just stay on a computer screen. It spilled over into the real world and caused actual clinical disruptions. We're talking about things that could directly impact your treatment. So what does clinical disruption actually look like? Well, a single breach can knock systems offline for days. That means critical services grind to a halt. appointments get canceled, even procedures get postponed. But maybe the biggest damage of all is the trust that gets destroyed. How can we rely on these digital systems if they're this fragile? Okay, so it's a huge problem. Now for the good news, or at least the what are we doing about it part. The entire industry is basically in a mad scramble for solutions. They know the old security playbook is totally broken, so they're having to build a completely new digital defense. And at the heart of this new defense is a powerful idea called zero trust architecture. The name says it all, really. The core principle is never trust, always verify. It's kind of like a super strict security guard at an office building. He doesn't care if he's seen you every day for 10 years. He's still going to check your ID every single time you walk through the door. No exceptions. So what does this zero trust idea look like in practice? Well, it's a whole new playbook. Step 1, mandate really strong authentication. The kind that's resistant to phishing. Step 2, instead of just checking on your vendors once a year, you monitor them constantly in real time. And step 3, enforce something called least privilege access. It basically means every partner gets keys to only the exact doors they need to open and nothing more. And it's not just the tech folks. Lawmakers are trying to get in on the action too. They're extending things that work like telehealth access, but they're also realizing that the old rules like HIPAA have some big gaps. For example, what about all that data from your fitness tracker or smartwatch? A new Senate bill is trying to close that exact loophole to make sure that information gets protected too. So at the end of the day, it all comes down to this. Our health, our actual well-being, now relies on this huge, complex, and, let's be honest, pretty fragile digital supply chain. And it leaves you with a really big question. In this new world, who is really in control?